Guys, let's begin. Так, Khan came to us. Now I pointed him. Khan number 4. 1, 2, 3 students now absent. Now I hope they will come. Guys, topic today. It is we need to work very quickly. I want to pay your attention to the main in this topic, which can you meet in your crock test. Disorders of the menstrual cycle. Now, the more modern name of abnormal bleedings usually. Так, Salim came to abnormal bleedings, the same as disorders of the menstrual cycle. Usually we write. Так, Suresh, сейчас, Salim, yes, and Suresh came to us. Now I take him. First of all, you need to know what does it mean menstruation. It is visible manifestation of the cyclic physiological uterine bleedings due to shedding of the endometrium following invisible interplay of hormones, mainly in the link hypothalama, pituitary, and ovary. Yes, we name this hypothalama, pituitary, ovarian axis. You see here the area of hypothalamus. Yes, which produced gonadotropin releasing hormones. Then the production of these hormones influence of stimulation of the pituitary gland, pituitary, and pituitary usually produce follicular stimulative hormone and luteinizer hormone. Follicular stimulation hormone influence on the production of the estrogens in the ovaries. Yes, ovaries, and luteinizer hormone production of the levels, hypothalamus, pituitary, ovary, or sometimes it's maybe uterus, we have abnormal bleedings, or we name this disorders of the menstrual cycle. As a doctors, you need to know how we count menstruation. Yes, it's significant to know because we indicated, for example, hormonal contraceptive drugs, and periods begin from them. Так, and Mvilimba came to us. Guys, I need to make screen now, 1 minute, yes? Так, and then again, we'll speak about our topic. Так, print screen. Guys, and it is from the beginning, first day of the first menstruation to the beginning of the first day of the next menstruation. And we call this menstrual cycle. Normally, the prolongation of the menstrual cycle from 31 to 35 days. Usually it is 28 days. Duration, it is 7 days, and amount of blood from 50 to 150 milliliters. Cyclic changes, guys, in the ovaries. What happened in the ovaries during the menstrual cycle? Usually the condition of the hormones of the ovaries influence on the growth of endometrium. It is internal layer of the uterus inside the uterine cavity. First of all, appear the primary follicles under the influence of estrogens. These primary follicles begin grow, yes, and one of these follicles contain egg cell and in the follicular cells, yes, and one of these follicle become dominant follicle, main follicle, which contain fetus egg, yes, with inside this follicle located follicular fluid, and this main follicle become more larger than other follicles, yes, and we name this mature follicle, and it can be in diameter 2.53 centimeters, and in the middle of menstrual cycle, under the influence of peak of estrogens and progesterone usually, yes, this follicle ruptured, yes, and what happened? Egg go outside the cavity of the follicle, outside the ovary, appear in the fallopian tube, and they meet with spermatozoid. Yes, if it is pregnancy begin developed, um, formed corpus luteum. If there is no pregnancy, we have empty follicle with regression of the tissues of the follicle, begin the atresia of the follicle and follicular cavity closed. If it is pregnancy, we have corpus luteum, which begin to produce progesterone, which is very important for development of the fetus egg. If there is no, we have the regresses of the corpus luteum. Yes. What happened in the uterus? Menstruation, you see here. Yes. When begin growth, follicle begin the proliferative phase inside the uterine cavity. Appear the additional vessels in the endometrium, and endometrium become more thick. In the peak of ovulation, endometrium usually is very thick, because endometrium is prepared of every menstrual cycle for pregnancy. Wait for the fetus egg. Yes, in the secretory phase, it is the beginning of formation of yellow body. The endometrium, the thickness of endometrium is the largest. Yes, and then begin the regression of yellow body, and appear the signs of degeneration. If the endometrium, we name this premenstrual phase, appear the spiral arteries become very wide, and begin desquamation of endometrium. We name this menstruation, when we see the blood, when we have blood discharges, and you see developing of the mature follicle, and then appearance of yellow body and regress of yellow body if there is no pregnancy. You see here two phases of the menstrual cycle. It is follicular phase, and second, it is progesterone phase, yes, phase of the yellow body, and the events which happened in the endometrium according to the phases of development of the ovary. Very significant for us to know if the woman has ovulation. And usually, if she has disorders, usually such woman has the problems with infertility. And the simplest test can show us if the woman has ovulation. First of all, it is measuring of basal temperature. You know that basal temperature, we many times talk about it. We measure in basal temperature in the rectum at the beginning of the menstrual cycle. What does it mean at the beginning? When begin the first day of the menstruation. Yes. Woman put the thermometer in the rectum, and every day in the same time in the morning she make the measuring. Yes, and if basal temperature has a monophase character, there is no changes of the temperature, prolong 1 month. Usually we make the measuring prolong 3 months and further make the conclusion. And if there is no this increase of basal temperature in the middle of ovulation to degree or 1.5, we speak about the if there is no, we speak about the absence of ovulation. If we have such kind of basal temperature, true phase of the menstrual cycle, it means that as soon as possible, woman has ovulation. Another, we name this functional test of diagnostic. Usually we use them if the woman has infertility and hormonal disorders. Another test also can point it us if the woman has ovulation or no. It is pupil symptom. Pupil, it's not pupil from the school, pupil in the eye. What does it mean, pupil symptom? It is accumulation of mucus in the external os of the cervix, not in the eye, as some student told me, but external os of the cervix. At this time, in the middle of menstrual cycle, if the woman has ovulation, usually it is the peak of estrogens and progesterone, it influence of the cervical mucosa, and cervical mucosa become not so thick. She has the possibility to over distension. It has the possibility to over distension, and it is created the good condition for penetration of spermatozoid inside the uterine cavity. And cervical mucosa helps promote this introduction of spermatozoid inside the uterine cavity. Usually, it is cylindric epithelium created with cervical mucosa, and in the middle of the menstrual cycle, we have the softening of the cervix as well, and that's why we have dilation of the external os of the cervix, yes, and due to this cervical mucosa accumulated in the cervical canal. And when we perform speculum examination, we see cervix looks like as a pupil. The accumulation of mucosa in the external os looks like as a pupil of the eye. Yes, and you see here 3 pluses. Yes, it is evident symptom of pupil symptom, and it means that woman has ovulation. It is also one of the tests of functional diagnostic. In the middle of the menstrual cycle, also very evident the firm tree symptom, and we have, if the woman has ovulation, we have evident crystallization of the cervical mucosa as fern tree, and it is also the sign of presence of ovulation. Also, we can use cytological investigation of vaginal smears, pycnotic index. Yes, you see here in the middle, it is 88%. What does it mean? Colpocytological investigation, usually we use till this time. It is in the proliferative phase. It is follicular phase, usually. Proliferative phase, it is the growth of endometrium inside the uterine cavity. You see this picture, yes? Superficial cells and intermediate cells are present. The cytoplasm of these cells is cyanotic. Karyopyknotic index, according to this, 20–40%. In the ovulatory phase, in the middle of the menstrual cycle, fragmental and small clusters of cells, cytoplasm is light, and karyopyknotic index 88. And in the secretory phase, when we have production, increase of production of progesterone, superficial and intermediate cells from immature blue-green and mature cytoplasm. It is pink color with glycogen granules. And karyopyknotic index at this time, it is 20–25%. Menstruation, disorders of menstruation, we classified as absent of menstruation. It is amenorrhea, it may be uterine bleedings, it is disorders of the menstrual cycle, it is painful menstruation with other symptoms. Etiological factor may be different, yes, emotional, hypothermia, nutritional, it may be infections, it may be inflammatory diseases of pelvic organs, or gynecological surgery. For example, after very extensive curettage of the uterine cavity, when together with endometrium, we remove basal layer. In these cases, we receive amenorrhea at all, and adhesions in the uterine cavity, which we name Asherman syndrome. Usually it is endocrine disorders of coagulation, parasitic diseases, genetics maybe, trauma, tumors very often, and professional hazards. Pay attention to this definition, guys. Usually, a single students can explain me what does it mean amenorrhea. Absent of menstruation, not так, how many students somebody came? Так, сейчас, guys, I need to see. Так, 12. Так, maybe amenorrhea divided, guys, to no, first of all, maybe primary amenorrhea. Usually it is exhausted ovaries, undeveloped of the ovaries, or maybe secondary amenorrhea, maybe false amenorrhea. If we have imperforate of the hymen, I will explain you, or maybe true amenorrhea. Secondary amenorrhea usually due to polycystic ovary or pituitary tumor IPM. Another terms, hypermenorrhea, increase the amount of blood during cyclic bleeding. Menorrhagia, significant increase in the amount of blood during menstruation. Prolongation up to 12 days. Hypomenorrhea, scanty menstruation. Polymenorrhea, menses lasting longer than 7 days. Oligo, это short and only 1-2 days duration of amenorrhea. Proamenorrhea, shortening of the duration of the menstrual cycle less than 21 days. And opsamenorrhea, rare menstruation in interval 36 to 3 months. Sometimes in Krog test present that women suffer from opsamenorrhea, for example, or hypomenorrhea. That's why I recommend you to look through these terms and remember them. If we speak about the types of amenorrhea according to classification, maybe physiological. Physiological, it is really not normal when menstruation is absent. It is childhood, it is pregnancy, it is lactation, and woman in menopause. And pathological amenorrhea may be due to anatomical factors, defect or lack of the uterus or vagina, or due to endocrine disorders. Hypomenstrual syndrome characterized by poor hypomenorrhea, short oligomenorrhea, and opsamenorrhea. Very often it happens if the woman has tuberculosis or after surgical treatment. Primary or true pathological amenorrhea, what are the main reasons? It is gonads, dysgenesia, gonads, it is, I hope that you know, it is sexual organs in men and women as well. Syndrome of testicular feminization, Morris, and primary hypofunction of the ovaries. It is resistant ovaries. Dysgenesia of gonads, Chereshevsky-Turner syndrome, was founded at 1938. Yes, and usually it is monosomy for X chromosome. You see here only one chromosome. What are the specific? To my mind, and Krog test one test devoted to this topic. Usually they describe you sexual infantilism, skin folds on the sides of the neck, at elbow stain. Etiology, I told you, what usually mammary gland are not developed. Secondary body hair appears spontaneously and sometimes very scanty. Uterus underdeveloped. Sex glands usually also absent and presented as connective tissues. Scrotum has a view of labia majora. We have hypoplasia of labia minora and funnel-shaped entrance to the vagina. Yes, it is in infantile woman we can meet underdeveloping of the sign of underdeveloping of the vagina. vagina. Diagnosis, the first one, it is determination of the sex chromatin, then and karyotype. And differential diagnosis we need to carry out with nanism. General view of the patient you see here, it is the girl of 14 years old, absent at all of the hair. You see the specific form, wing-like form of the neck of this woman, and sphinx-like face of this sphinx. Yes, and no, usually if you saw sphinx, it's reminds us a sphinx head. Yes, in this woman, but usually remember this the form of the neck usually present absent of menstruation, and the absent of the normal uterus and adnexa. Usually it is the girl with Shereshevsky-Turner syndrome. Treatment, it is reconstructive surgery, plastic surgery, hormonal treatment, and psychotherapeutic. Of course, they cannot have children. Usually we can improve only the view of this woman. Syndrome of testicular feminization, you know that this syndrome is present in your Krog test. Usually it is 46XY chromosome, yes, and absent of 5 alpha reductase. Due to this lack of testosterone receptors, and woman has female type but male testes usually, yes, which located very often in the labia majora. Also present amenorrhea. Then another disorders of ovaries, it is the exhausted ovaries. Usually hyperfunction of the ovaries, maybe we have hypermenstrual syndrome, underdevelopment of the sexual organs, hyperplasia of external and internal sexual organs. The main what we need to do, we need to estimate the gonadotropins in the blood and sexual steroids as well. We have increased the level of follicular stimulative hormone and luteinizing hormone on the background of hypoestrogeny. Usually we have the decrease of estrogens, which is gonadotropins of the ovaries. For diagnostic, we use ultrasound investigation and laparoscopic. Usually it caused by infection or tumors. True amenorrhea, which could but other outside of gynecology factors, outside of the outside the sexual organs. Yes, it is congenital, adrenogenital. Guys, who want to ask me somebody what happened? Natalia? No. Guys, lesions of central nervous system and hip area, hypothalamus, hypophyseal area, and destruction of endometrium. True pathological amenorrhea. Так, it is. Так, сейчас, guys, true pathological adrenogenital syndrome. Guys, also, no, which we have here slides, sometimes they appear in Krog tests. What is the reason of this condition? It is hyperfunction of cortical layer of the adrenal glands. And what characterize adrenogenital syndrome? Very early begin the puberty period at the age of 6-7 age. It is virilization sign, forming of skeleton and body building according to masculine type. Children are low height, low extremities, and short because of early epiphyseal cartilage closing. Of course, in girls present amenorrhea and infertility. Treatment, it is glucocorticoids, first of all, prednisolone, cortisone, dexamethasone, prescribe to decrease androgens production by adrenal glands. Secondary to pathological amenorrhea may be hypothalamic, according to the layers, yes, hypothalamic, hypophyseal, pituitary gland, ovarian, or uterine pathological amenorrhea. Chiari-Frommel syndrome, guys, it is high level of prolactin in your croc test. Yes, maybe you can see Chiari-Frommel syndrome because it is not disease. It is one of the symptoms. For example, it's maybe due to the lesions of hypothalamic center. It's maybe due to the tumor of pituitary gland. Usually characterized by lowering of estrogens amount. Guys, we have 9 minutes, then without break we begin again. Without break because we have no allotted time. Amenorrhea and then atrophy of external and internal genitals. And basically it is galactorrhea, and usually with increase of the level of prolactin. That's why if we have a tumor, we have exclude the tumor. That's why X-ray or examination of Turkish saddle, computer tomography examination. Usually, if it is tumor of pituitary gland, we have the changes of vision. That's why examination of acuity and field of vision. Then determination of sexual hormones. Usually, we have increase of the level of prolactin. Cytological research of vaginal smears, lowering of the estrogen amounts, and treatment. Usually we use prolactin inhibitors, Parladel, Camphora, or Bromcamphora. You see here treatment. I never saw these questions, but remember about Parladel, guys. Maybe in croc test for treatment of galactorrhea or hyperprolactinemia. Syndrome Sheikhana, I told you about it a lot, appear due to the ischemia of the pituitary gland during bleeding. Massive bleeding, more than 800 milliliters, can cause development of Sheikhana syndrome. Usually it is atrophy, first of all, amenorrhea, absence of menstruation. Atrophy of external and internal genitals, amenorrhea, hypoplasia, frigidity, decreases in disappearance pubic and axillary hair growth. And usually you have two questions in croc. Estimation of gonadotropin levels, they ask you, or to set the diagnosis. It is Sheikhana syndrome. Guys, polycystic ovarian syndrome, it is the normal ovary. You see here the structure, yes, and it is the ovary in polycystic ovarian syndrome. You see here the woman, masculine type of the growth of the hair on the face. You see, yes, underdevelopment of mammary glands, but maybe normal size of mammary glands. First of all, the main symptoms of polycystic ovarian syndrome. Other name, it is Stein-Leventhal syndrome, and other name sclerocystotic ovaries. Yes, the main symptoms, it is hirsutism. You see growth of the hair on the breast, yes, on the masculine time of the growth of the hair on the anterior abdomen wall. Yes, no face we have, we cannot see in these girls the face, but usually it is hirsutism. It is disorders of the menstrual cycle, it is obesity, and very often it is infertility if we don't treat this syndrome. How looks like ovaries? Usually they increase in size, very large. If we compare with the size of the uterus, uterus is small, and during ultrasound investigation, we can see thick capsula due to the dense membrane which appear on the influence of androgens. Yes, we have increase of the level of androgens. That's why we see the symptom of masculinization of the woman. Then, and pay attention to the ovaries. A lot of ovaries near the margin of the ovary. Yes, it is specific for polycystic ovarian syndrome. And usually girls have the delay of menstruation or sometimes amenorrhea, and usually monophase temperature. What show us monophase temperature? There is no ovulation at all. Clinical diagnostic criteria. Usually menarche come in time, but from year to year, step by step, we have the aggravation of situation. The delay between the menstruation become very prolonged. Then we have oligomenorrhea, decrease the amount of blood, yes, and sometimes a true amenorrhea. No, very rare. Usually we have the delay of menstruation and irregular menstrual cycle. Hirsutism appear together with menarche, first menstruation, obesity, and usually specific it is primary infertility. If we speak about the macroscopic changes, we have the enlargement of the ovaries into 6 times and presence of multiple cysts inside the ovary. Usually the surface of the ovary is smooth, they have dense capsule, whitish, pearl shades. Then and tree-like small vessels on the capsula. Capsula is thick if we cut this capsula, stroma tight with the peripheral location of the small follicles. You saw this on during ultrasound picture, which I show you. We have morphological changes. It is hyperplasia of the stroma of the ovary and hyperplasia of the thecat cells in the follicles. In hormonal investigation, we have increased the level of luteinizing hormone and increased the ratio between luteinizing hormone and follicular stimulative hormone. And usually, if we inspected urine, we have increase of the level of 17 ketosteroids, slightly increased, but it is specific sign of this ovarian disorders. Anti-androgen therapy in order to decrease the level of androgens. It is cyproteron, Anrocur, Diana 35, very good, spironolactone, overaspiron, dienages, janin, or drosperinon, or jasmine. Indications for these drugs, it is hirsutism together with menstrual dysfunctions. Very good for stimulation of ovulation. In these cases, it is clomiphene. Gonadotropin preparations and gonadotropin releasing hormone. Pay attention to the last one. It is surgical stimulate of ovulation. It may be resection of part of the ovary. It may be cautery of the ovaries, which we usually perform during laparoscopic operation. We make the holes in the ovary with the help of high temperature. Else, stay the ovary. What is the purpose of this surgical treatment? Usually it depends on the wishes of the woman. If the woman wish to be pregnant as soon as possible, we suggested non-hormonal treatment, but on the background of stimulation of ovulation, for example, with the help of clomiphene, we suggested surgical treatment. Yes, what happened after ovulation? We remove a part of this thick capsula and we created artificial way for outflow of follicular liquid. Yes, we created ovulation, and it's maybe possible under the background of stimulation of ovulation. In this time, women begin to we suggested sexual life as soon as possible just after operation, and women prolong a half a year have a high choice to be pregnant after the operation. If the woman want only to make her menstrual cycle regular, enough the stimulation of ovulation. Guys, now I stop my demonstration and again begin demonstration after 3 minutes. Yes, because we have less than 1 minute. I stop